Namaste all the viewers and our subscribers who are watching these videos of ours and inspiring us to do more and more videos on health, well-being and natural healing solutions. In this series of talks, today I have chosen the topic of varicose veins. Varicose veins, you must have heard about it quite a lot and probably seen also in your friends and relative circle. What does that mean? Varicose means in Latin, it is tortuous or twisted. Veins are the one which carries the deoxygenated or impure blood from the periphery, from the extremities back to the heart for oxygenation of the blood, for nourishment. So usually what happens is when the heart pumps the blood towards the cells to supply the blood, it has a pumping action. But the deoxygenated blood, when it has to travel back to the heart against the gravity, it doesn't have any pumping mechanism. So by creation, all these veins have what is called as valves. These valves prevent the blood not to flow back to the periphery, instead slowly travel back to the heart. In varicose veins, what exactly happens? Due to various reasons, which we'll discuss a little later, the valves and the walls of the veins become weaker. When it becomes weaker, automatically the vein won't stand tall. Instead, it becomes tortuous and twisted. That's what it presents with. And the blood is pooled, leading to swelling of the veins. This is what varicose veins is all about. How do we identify? Just by watching it or seeing it in the peripheries, especially in our legs, we can see the varicose veins very clearly. A milder version of varicose veins is called as spider veins. Spider veins are just like spider web. It is not swollen, but it is a milder version that it is progressing towards it, is what it indicates for us. What are the usual symptoms, how it presents? Apart from watching the varicose veins on our skin, we may have cramping in our legs, especially in our periphery calf muscles, ache in the musculature, swelling in the feet, and also sometimes itching around the veins on the skin. These are some of the symptoms what we watch. When it progresses to a large extent, the pain can be debilitating, cramps can be very bad as well. That's when we have to seek advice and treatment. What are all the possible causes? Ladies or female population is more prone to this varicose veins because of the lot of variation, pregnancy, hormonal variations, maybe sometimes birth control pills. They all make the walls and valves of the vein little bit weaker and leading to varicose veins. And one of the most important factors is obesity, or overweight is another factor which puts pressure because the fat accumulation on the veins causing the valves and walls of the vein to be tortuous. And at the same time, heredity factor also can be there many a times, which is a major factor for varicose veins to come to next generation as well. One of the important factors is lack of movement and standing for long hours and sitting for long hours, which is the norm of the day these days, is one of the major factor why the varicose veins are increasing these days. And what are the complications of varicose veins? Usually it can cause an ulcer, bleeding and in a lot of pain. These are the main three things. Ulcers can be non-healing in case if they have diabetes, and it can bleed, which is a very major complication which can lead to a lot of complications in our health. So these are some of the complications of varicose veins. I hope you have understood how it is caused, what are all the risk factors, what are all the symptoms, and what are all the complications of varicose veins. In this episode, we'll stop it here, and in my next episode, let us discuss about the solutions for varicose veins. Thanks for watching.